Dr. Brandon,
Dr. Morgentaler.
what a pleasure to be with you again. Yo, yo, yo. So I got a story I want to tell you today. To me, this is an amazing story that really speaks to how narrative, stories themselves, can profoundly affect how even the smartest scientists, the sort of evidence-based scientific world, can be totally bamboozled, if you will, into thinking the wrong thing about something because of a story.
I'm not surprised because within the field of psychology, we understand that that same sort of thing can happen for people. They develop a narrative based on like information that they misremember or whatever, and they develop an identity around it. So it's the same kind of
Right.
stickiness.
Exactly.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
So this is a story about testosterone and prostate cancer. So it's been over 80 years since it was first asserted that testosterone activates prostate cancer. And along the way, it developed, that was back in the 1940s. And by the time I was in my training in the 1980s, I heard all these various other pieces that went to stories, if you will, that went along with the idea that testosterone was amazingly dangerous for prostate cancer, that it caused it. And if you gave testosterone, we never gave testosterone to people back in the 1980s. That we were so fearful of it.
Yeah, it was a death sentence.
Yeah. And one of the pieces of that story that I want to talk to you about today is the assertion that eunuchs never get prostate cancer.
So, I've heard you say this before, but I have to tell you, like this concept of eunuch, like I'm not even entirely sure what that is.
Okay. So a eunuch is a man who basically had his testicles removed.
But this is an old-fashioned term. This isn't like a modern day.
Well, we still talk about eunuchs. Like it's still.
I don't talk.
Well, you're not talking about prostate cancer. So urologists are the surgeons of the testicles. And we actually created many eunuchs in, I want to say the modern era, except in the modern era, we don't do it anymore. But when I was a resident in the 1980s, and a man came into usually through the emergency room with pain in his bones that was so terrible. That's why he ended up in the emergency room. And they figured out it was from prostate cancer. We did an operation to remove their testicles. Testicles were the source of testosterone. They are the source of testosterone. By removing the testicles, testosterone dropped, and the men would get relief from their pain.
Wow.
Yeah, but the story, that, as I was told, was that eunuchs never get prostate cancer. Now, eunuchs are not only they go back in history over about 10,000 years.
Right. This is a real old term, I think.
It's not that the term is old, it's just that we don't have a lot of eunuchs anymore, which is part of why the story is funny, okay? Although I may not have explained the humor in it yet.
Yeah.
But a eunuch refers to somebody who had his testicles removed, and historically this was done for a variety of reasons. Prisoners of war, ancient societies, they would cut off the opposing warriors' testicles. But there was also, especially in some empires, like some of the Chinese dynasties, is that eunuchs often had important places in the royal kingdom, in the royal structure. And so they would undergo procedures to have their testicles removed when they were young. And
that's awful.
Awful. And yet some of them had high positions and were relatively respected. It was eunuchs that used to guard over the king's harems in different cultures. So the story goes like this. So I'm a resident. I'm hearing about how testosterone is so bad for prostate cancer. And there's some lecture or some attending urologist said, well, of course, eunuchs don't get prostate cancer. And the comment was made to show that you need a testosterone in order for prostate cancer to develop.
Mm-hmm.
And when it was over, I was a junior resident, lowest level, and I turned to my chief resident, and the chief residents knew everything. And this guy's name was Noel DiFilippo. He was a great guy. He knew all the answers to
We
all
have
the
to reach out to
questions.
him.
Yeah, and Noel DiFilippo, what a guy. And I said, Noel, how do they know that eunuchs don't get prostate cancer? I've never seen a eunuch.
Yeah.
And Noel knew all the answers, and he said, the castrati. I said, what are the castrati? He said, look it up. So those were the days you had to look up a lot because
Yeah,
you're in
as a chief
training.
resident.
Well, he was the chief. I was the junior. I had to figure things out.
Right.
So the castrati was a group of singers who sang opera in all the opera houses. They went around Europe. And as boys, they would have their testicles removed, or they had other procedures to deprive them of their testicular function so that their high-pitched voices stayed high through adulthood.
Yeah, it's kind of
Okay.
awful.
Kind of awful, but they were famous for their pure tone. and they went around Europe. They had a great life.
Hmm.
And from my reading, the families often would actually willingly do this to the boys, hoping without even a guarantee that they could become part of the castrati.
Wow.
So that kind of was satisfactory to me as an explanation at that time. But I had to move on. There was a lot to learn.
Noel, he kept the thing going. Like he had to come up with
There was
stuff.
there was a lot to learn about other
Oh,
things, not just
I
testosterone and eunuchs. But that was the sort of the answer, and the castrati. That's how we knew. It was only later in my career, now out as an attending, now giving testosterone to men, and seeing that the men I was giving testosterone to weren't getting prostate cancer, that at some point I had to figure out what the heck is going on here, and what was the story, at least as part of the story, about the eunuchs never get prostate cancer. Because we, just like you mentioned, it's old-fashioned, we don't see eunuchs.
Right.
Yeah. So you'll be happy to know there are no studies of eunuchs looking to see if they had prostate cancer. But if you go into the literature about why people said this, so the castrati do come up, but the weird thing is that the last castrati, or castrato in singular, was a guy named Alessandro Moreschi, and there actually are recordings of him that have survived, because I'm not sure when recordings were, but they were in his lifetime in the early 1900s. But he died in 1922. Okay? So 1922, we still didn't have, it would be another 70 years before we would have the blood test PSA.
Well, wait, so why don't you just explain PSA really quick?
PSA is the blood test. Prostate is called, PSA is short for prostate specific antigen. Most men, if they're 40 plus or 50 plus, have had a PSA test. This is how we look for prostate cancer these days. The other ways we do, especially urologists do, digital rectal exams. A doctor puts a gloved hand inside the anus. You can feel the prostate there, and if it feels like there's a bump or a lump or some irregularity, that raises the suspicion that that could be cancer too. But let me tell you something. Back when the castrati was living, nobody was doing rectal exams on anybody for any reason. The castrati, I'm sorry, Noel, it was the right answer at the time, but it turned out that we learned nothing from the castrati about prostate cancer.
There was no data, no research, nothing about the castrati.
All those castrati could have died of prostate cancer for all we know. Nobody would have known.
Wow.
And a lot of prostate cancer deaths went undiagnosed. They just died of something, right?
Well, since Noel knew everything, why did he think
That's what he was taught, and that it wasn't his fault. He gave the right answer for that.
Absolved Noel.
That was the right thing. But then I looked further, and there was one reference where people said, oh, in China, they did a study where they examined the last remaining eunuchs from the last Chinese dynasty, which I believe is pronounced Qing, spelled Qing. So this was around 1960, and it was by two Chinese physicians. And I had to look that up.
Yeah. Had
At a time when it wasn't easy to find these things, had to go to this physical building called a library to find these old articles.
Still exists,
They
libraries.
still exist,
Yeah.
yeah. But now you can get most articles online.
True enough.
In seconds. So this article was often now given as proof. And what they had done was they had examined 26 remaining eunuchs. The Qing dynasty ended, I don't remember, in the 50s, maybe, something like that. And these guys, there were 26 of these guys who still existed from an original population
Wow.
of over 1,000.
Oh my goodness.
Okay, this was a common thing, and sort of you didn't have to be the king to have a eunuch, just somehow related to the royal family, and people had many of them, and they did different tasks, and they were thought to be wise, and
Without so a man without testosterone is wise. I'm just noticing that.
I mean, I know, weird, right? Maybe, I don't know, but they weren't distracted by the females so much.
That's true.
Yeah. So here's this article that's referenced as part of the evidence that is that eunuchs didn't get prostate cancer. So here's what they did. All they did is a physical exam. And they only had 26 out of a couple of thousand that survived. Their average age was 72. And there's not one word about prostate cancer in that article.
Wow.
Not one.
Yeah.
But on examination, the prostates of these guys were impalpable. You couldn't feel them. They were small. They were small. Again, 1960, we didn't get PSA, the blood test, till really the early 1990s. These guys were not being examined for prostate cancer. And once again, these were the last remaining 26. There could have been thousands who had died of prostate cancer before, but we would never know. These are the survivors.
Oh, yeah.
So again, not evidence. In fact, what the evidence shows is, although it's not common and we don't have a lot of eunuchs, there are case reports of men who lost their testicles at a young age and didn't go on testosterone and developed prostate cancer later on. I was actually involved in a very interesting study with Louis Gooren, Gooren, who from the Netherlands, who was the guru of transgender medicine long before it was a thing. And people would travel to the Netherlands to see him, and he had a group, and they did male to female and female to men, and often it was just hormones what they did. But they had individuals from male to female who had their testicles removed, usually after age 18, and then went on female hormones like estrogen. And this was a study that kept great records of individuals that had been followed for at least 20 years.
Wow.
So their average age was, I forget exactly, but early 50s. And there was one case out of about 300. So rare, but it happens. And they were young for adult men, right? We don't diagnose a lot of prostate cancer in men in their 50s. So the conclusion of that paper in the male to female transgender folks is cancer is rare, at least in that age group, but it can happen. And these individuals should be screened beginning at age 50. And who knows what we'll find as some of these individuals get into their 60s and 70s. We really don't know. But the point is, it happens. But the upshot of this whole story is there are still people who say to me, I had a really smart urologist involved in guidelines where we were corresponding about some of the stuff around testosterone and prostate cancer. And one of the points he made is, well, eunuchs never get prostate cancer. And it reminded me of this story, and which was never true. It was never true. The data never existed the way people thought. Castrati was was not a relevant answer, and sorry, no. And the Chinese investigation of the remaining eunuchs never looked for prostate cancer.
So interesting, because these popular narratives can often be wrong.
Yeah, wrong.
Hmm.
But what they do is they add color to a story that makes it feel like that story has depth in more than one ways, and it helps to establish it in a way that then becomes really resistant to
Right.
new interpretations.
So it helps
of
to
data.
establish a fiction.
Yeah. So for any of you who have heard, especially if there are any urologists watching or endocrinologists, that eunuchs never get prostate cancer, the
Wrong.
story is just bunk. It's just nonsense. They can get it. It may not happen at a high rate, but they can get it. And this whole idea that testosterone causes prostate cancer never had any basis, in fact. Never. There's not one piece of evidence that that's true.
So a low level of testosterone is not protective of getting prostate cancer.
It's a slightly different statement, but is still true.
Uh-huh.
And as a matter of fact, my first big paper was in 1996, where I did prostate biopsies in men with low levels. They weren't eunuchs, but they had low levels of testosterone, and I required them. I was so worried about prostate cancer back then that I required men to have a prostate biopsy, even if their PSA was normal, before I gave them testosterone, because my fear was that if we found even a little speck of prostate cancer, it would grow like wildfire
Right.
if we raised their testosterone. And the belief at that time, this is the mid 1990s, was that not only did high testosterone cause prostate cancer, it was a risk, but men with low testosterone should be protected because of the eunuch story.
There we go. And so
And the results of those, we published 2 studies, one in JAMA in 1996 and a follow-up in a larger sample of 345 men some years later. And the rates of prostate cancer were 1 out of 7 of these men with a normal PSA were found to have cancer just by sticking a few needles in their prostate.
So 1 out of 7 with normal PSA,
But low
but
testosterone.
low testosterone.
So the idea that low testosterone is protective is completely nonsense.
So what about with women? Do women get prostate cancer?
You always ask.
Well,
So
these
listen,
are important.
So here's the thing. So women do get some version of prostate cancer, but it's rare.
Do they call it prostate cancer?
No, but here's the thing. So women have an equivalent set of glands or ducts to the prostate. In the male, during fetal development, under the influence of testosterone, those glands coalesce and they form into an actual physical structure you can feel, usually after puberty in a male, as a prostate. Women have a less organized set of glands that surround the urethra. They're often called the periurethral glands. Peri means around. And they're given the name Skene's glands, Skene, after some guy named Skene's. And there are cancers that form in those glands, super rare, but those glands produce prostate-specific antigen. And it's called prostate-specific antigen, or PSA, because it's specific to prostate-like tissue.
Interesting. And so why then would women have a lower rate of prostate cancer than men
Well,
in general?
it could be because their testosterone is so low and low throughout their whole lives. Could be because they never develop a full-blown prostate.
Well, doesn't this create a problem for your theories about testosterone and
No, because women are, I don't know if you're aware of this, but women and men are a little different.
yeah, you know what? Yeah,
We're different.
got
We're
that
different.
memo.
We're different hormonally.
yeah.
And whatever it is that causes men to get prostate cancer may not apply that much to women.
So it's sort of similar to the amount of breast cancer in men. Is that an appropriate analogy?
Yeah, there may be an analogy like that too, because men also have breasts and
Right.
men also get breast cancer,
But not much.
but quite rare.
Right.
Yeah. So maybe that's the right answer.
You know?
Well, there you have it. And the point is, stories can win the day even for people who swear up and down the Bible that it's all about the evidence for them. It's not. We're human beings. Our brains are really vulnerable to storytelling. And fun to talk about it. Great to be with you. Dr. B. Yo, 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 we're out.
Thank you, Dr. M.